Welcome to Your Family's Health, the program that focuses on healthcare issues with unique and different modalities for taking charge of your health today. Experts talk weekly with our continuing roster of guests from around the country and right here in Nassau County to keep you up to date on the latest health issues and trends. Take care of your mind, body, and soul. Spend the next half hour with the voice of Nassau Community College, 90.3 WHPC, and get on the journey to better health.
Hello and welcome to Your Family's Health. My name is Dr. Jeanine Cook-Garard from the Nursing Department here at Nassau Community College. And today, I don't want to make anyone feel nervous, but we are going to learn all about the body's nervous system. Our guest today is Dr. David Chalif, the Chief Neurosurgery at Southside Hospital in Bayshore here on Long Island, and the Director of Northwell Health Brain Aneurysm Center. Welcome to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. Welcome.
Thank you for having me, Jeanine.
So first, tell us about what you do and how what you do is impacted by COVID and how you are impacted by COVID personally.
Well, what I do is I am a neurosurgeon. And prior to about a year ago, I was a neurosurgeon at North Shore Hospital for 33 years. My primary interest is neurosurgery of the brain, that is brain tumors and aneurysms. And with the help of a number of my colleagues at North Shore, we put together what was called the Brain Aneurysm Center. And for almost 2 decades, we created a very large program that treated patients in a multimodality fashion, inclusive of surgery, ICU care, endovascular care for cerebral aneurysms and related disorders. And I was then promoted to be the Chief of Neurosurgery here in Bayshore at Southside Hospital, which is also Northwell Health. And prior to March 1st, when COVID really hit, or maybe about March 15th, we were in the process about 7 months into recruiting neurosurgeons and nurse practitioners and angiographers and building, with the help of the Northwell administration, a world-class neurosurgery program here in Bayshore that would be somewhat like a North Shore hospital on the South Shore. Mm-hmm. And then, to answer the second part of your question, around mid-March, COVID hit, and Suffolk County was particularly hard hit. The hospital added a tent, which is still existent, up on Montauk Highway in front of the hospital. And the hospital became, for a brief period, for about a month, a COVID hospital where almost 80-90% of all the patients in the hospital were COVID positive. And there were, at one point, almost 140 patients on a ventilator. So the numbers, thankfully, have gone way, way down. Mm. And when that all happened, we stopped doing elective neurosurgery. And what was interesting, and this was seen all over the tri-state region, is that our emergencies went down also, and everything seemed to shut down except for the COVID. And now we're starting to book elective operations. We're seeing more patients in the emergency room, and we're trying to get back to a normal state of growth at Southside Hospital, picking up where we left off and starting to do operations. I operated this morning. We operated last week. And this is not only at Southside, this is across the whole Northwell system. Mm-hmm. So we had a big impact from COVID. Many of our PAs and nurses also were redeployed, as were some of our physicians, to render intensive care to the COVID patients. So I'm very proud of my team, our nurses, our PAs, and our attending physicians in neurosurgery, who were, many of them, redeployed to take care of the COVID patients. So that was in March and April. May has now passed. We're in June. Things are quieting down. The numbers have come down. The ICU has been deep cleaned, and we are starting back to what I would call a new normal in the hospital.
Yeah. So let me just first say thank you for all that you do and have done as it relates to COVID, the pandemic, and congratulations on being promoted last year to Chief of Neurosurgery at Southside. So can you just changing gears a little bit? Can you quickly explain what the nervous system is in our body and what it does, and some common procedures that you engage with in your role there in the hospital?
Well, I mean, to explain what the nervous system does would be a whole course in neurophysiology, but the brain controls all the functions of the body. The field of neurosurgery is a very, very broad field. As a matter of fact, there are very few neurosurgeons these days who are not super specialized. A neurosurgeon is a specialist to begin with, but there are very few neurosurgeons who are not specialized into a particular niche in neurosurgery. Mm-hmm. For instance, I do mostly aneurysm surgery and brain tumors, but there are neurosurgeons who do pediatric neurosurgery or spinal neurosurgery or surgery for Parkinson's disease, which is called deep brain stimulation. Mm-hmm. So it is a very broad field that treats a huge number of disorders, including trauma, including hemorrhage in the brain, including benign tumors and malignant tumors. So there's an oncology element to neurosurgery as well. It is a very broad field, and it is a field that is also very dependent to an extent on neuro-intensive care units, angiography, round-the-clock nursing, round-the-clock PAs. So it is a multi-modality field. And one of the things I love about my job is I interact with a lot of other individuals every day, mm-hmm. from PAs to nurses to neuro-intensive care doctors to neurologists, etc., trauma physicians, surgeons, general surgeons. So it's a very broad field. And my particular interest in neurosurgery is, as I mentioned earlier, brain tumors, benign and malignant, and aneurysms in the brain, which we'll talk about hopefully. And what we're building here at Southside is a multi-modality treatment, not just for brain tumors and aneurysms, but spine, trauma, the whole gamut of neurosurgery.
Can you tell us specifically what is an aneurysm?
Okay. An aneurysm is basically a bubble on an artery at the base of the brain. And there's a circle of vessels under the brain that was discovered in the 1600s by an anatomist named Thomas Willis. And to this day, it is still called the Circle of Willis. That is where all the vessels at the base of the brain come together. And where there are branch points on this circle, there can be weak spots. And over the years, the weak spot can develop into a thin-walled bubble. Mm-hmm. And the risk of the bubble is that the bubble can burst. And when that bubble bursts, it is essentially an artery in the brain that is rupturing. And it is a cataclysmic, sudden event that can affect people in the prime of their life without a warning. Mm-hmm. So basically what an aneurysm is a very thin-walled bubble at the base of the brain on an artery.
And who are predisposed to aneurysms?
There's really no predisposition. We think people with hypertension are predisposed. We think people who are cigarette smokers are predisposed. People with a family history of aneurysms and many relatives could conceivably be predisposed, or people with certain kidney disorders, such as polycystic kidney disease, can be predisposed. But for the most part, the aneurysms can occur in otherwise healthy people, and there's no predisposition.
Are there any warning signs?
Very good question. Usually not. Usually someone is fine before an aneurysm ruptures. But sometimes there's an entity called a sentinel bleed, which is a warning leak. And frequently we have patients come into the hospital with a very serious bleed, and the family or the patient would relate to us, it's funny that that they had a very bad headache 10 days earlier that lasted a couple of days, but they didn't go to a doctor. That could have essentially been a warning, a warning leak. And that is why we tell anyone who has a severe sudden headache, everyone suffers headaches, but if someone has a severe sudden headache, that they should go to the emergency room or an urgent center or their primary physician. One other thing that I think is important for your audience to understand is that we deal with two types of aneurysms in the brain. One is what I was talking about, aneurysms that have ruptured, exploded, bled. The other are aneurysms that are found by accident. And in the current state of medicine, there are many entities which would cause a primary care physician or a neurologist to order an MRI. Vertigo, a TIA, a migraine. The list is almost endless. And we see many patients who find out they have aneurysms before they bled. And we have criteria that we look at to see if we should do, for lack of a better term, a preemptive strike on the aneurysm, get it before it gets us. And basically, we look at the size of the aneurysm and the age of the patient. If the aneurysm is greater than 5 to 7 millimeters and the patient is under 65 and in good condition, we would advocate treating that aneurysm so we can neutralize it before it bleeds. And one final thing that I think is important is that when I say treat the aneurysm, and this applies to both ruptured and unruptured aneurysms, there are two ways to get rid of an aneurysm. One is what I do, and that is going through brain surgery, going through the head, finding the aneurysm and putting a titanium clip on the aneurysm, which I have done for 34 years and is a very well-tolerated operation.
Well, I'm just going to interrupt you right there with the titanium clip. What does that look like? Is it kind of a cutting off the area that's damaged, or is that sort of like putting something in to keep the vessel open?
Okay.
How does that work?
Okay. It is basically, if you think of a pipe, like a garden hose with a bubble on it, that is what an aneurysm is, the bubble. The clip is a highly engineered titanium clip that we put on the bubble flush to the main pipe, thereby excluding it from the main circulation. So it cannot get blood anymore. The blood will flow in the main pipe, and the aneurysm becomes diffused and inert. Right. Anyway, what I was saying prior to that was there are two ways that we can get rid of aneurysms or treat them. One is what I just described as microsurgery, brain surgery, placing a clip on an aneurysm. And the other is a newer technique. The first aneurysm in history was clipped in 1937. It's a long time ago. But about 20 years ago, maybe 25 years ago, a new technique was introduced, and it's really come a long way since then. And that is similar. Many people have heard of putting stents in the heart, which is done through the groin. Mm-hmm. There are ways now to go up from internally through the groin, up to the head, and put either platinum coils in the aneurysm or a stent across the base of the aneurysm. So we look at each case and decide what's better, endovascular, going through the groin, or an open operation, which is what I do.
And which is safer?
It depends. Each case is different. Yeah. There may be a case where the coiling is safer, and there may be a case where the microsurgery is indicated and therefore safer. If both modalities can be done on the same aneurysm, there is a feeling that the endovascular is safer because it is somewhat less invasive. It is not a non-invasive technique by any means. There is a wire and a catheter going into the brain. It's done under general anesthesia. But generally speaking, it may be safer to go that route if possible. Some aneurysms don't have the right location or size, and there are other factors such as the severity of hemorrhage which would dictate the surgery. but the endovascular technique going through the groin was a big game changer in this field. And if I look back prior to the advent of endovascular and all the 2,000 aneurysms that I operated on, I would think that a fairly significant percentage of those would have been treated with a less invasive technique. Mm-hmm. I tried to tell patients that the endovascular technique is somewhat similar to how cardiac stents change open heart surgery.
Mm-hmm. That's fascinating. You're listening to Your Family's Health on the voice of Nassau Community College, 90.3 WHBC. My name is Dr. Jeanine Cook-Garard, and today we're talking about the nervous system in our bodies and the treatments available for some of the disorders with Dr. David Chalif, the Chief Neurosurgery at Southside Hospital in Bay Shore here on Long Island, and the director of the Northwell Health's Brain Aneurysm Center. So, Dr. Chalif, how long have you been doing this work?
Well, I finished medical school in 1979. That was 41 years ago. And then I did a 7-year training, which I finished in 1986. I trained at NYU. So that was where I really learned the craft. But in this field, you really never stop learning. I guess the day that you retire is the day that you stop learning, because it's the type of field where one thing leads to another, and just compounds your fund of knowledge. And for me, I learn something every day when I enter the hospital and look at a new case or meet a new patient. Mm-hmm. But I've been doing it for subsequent to my residency. This is going to be the end of year 34. It went very quickly, but 34 years.
So we're talking about brain aneurysms. Who do you see mostly? Is it the older adult, or are you seeing more people, minority groups? Who do you see more with this condition?
The average age of someone with an aneurysm is 55 years old. There is a slight preponderance towards women. It is not specifically seen in a minority group, except that somewhat similar to COVID, I would think, there are maybe more pre-existing health conditions in the minority groups, perhaps maybe more hypertension, but aneurysms really do not discriminate along those lines. The youngest aneurysm I've ever operated on was 8 or 9. This is extremely unusual. Aneurysms are really not diseases of children. We've had a few over the years, but it's rare. And we've seen aneurysms in 80-year-olds and 90-year-olds as well. But the thing about it is, when someone ruptures an aneurysm, they're generally in the prime of their life, working, being part of society, adding to society, and healthy. So it is really not a disease of minorities or old people or young people. It is a disease that inexplicably strikes down people in the prime of their working life. Now, the fact that children, for the most part, do not have aneurysms, and the age group that is the average group is 55, would suggest that they develop over the course of a lifetime. With each beat of the heart, if there's a weak spot in the blood vessel, it could enlarge. So aneurysms are a disease of middle life.
And if I am concerned with this and I have a headache or have some things that I would associate with brain health, okay, what would be a warning sign that I'm having an aneurysm? Is it a headache? Is it something? Tell me what I can expect.
Well, for brain health in general, if you have any general worries, you should go to your primary care physician or a neurologist. Specifically for aneurysms, for the most part, now aneurysms can present themselves by pressing on various nerves in the brain, causing visual problems and other problems, but predominantly aneurysms present when they rupture with headache. And as I said earlier, almost everyone's had headaches. People have had migraines. Headache is a very common malady that people suffer. But when someone has the worst headache of their life or something really out of the ordinary, that's when they should seek medical attention. And an aneurysm can be diagnosed in 3 minutes, a rupture of an aneurysm, in 2 minutes with a CAT scan. And if someone is worried that they could have an aneurysm, for instance, say someone has a first-degree relative and a grandparent and aneurysms run in their family, there are tests called CTAs, which is a CAT scan with contrast, or MRA, which is a form of an MRI, that could non-invasively diagnose an aneurysm.
So that's great to know. So 2020 marks the 12th annual Long Island Brain Aneurysm Awareness Walk, which I understand is co-hosted by Northwell Health's Brain Aneurysm Center. Can you talk about that? Sounds very interesting.
I really would like to. About 12 years ago, I mentioned that we developed this program at North Shore Hospital, and we called ourselves the Brain Aneurysm Center. We asked ourselves, how could we give back a little? How could we give back financially? How could we give back with research? And how could we give back, most importantly, with awareness?
Yes.
The aneurysms are almost a disease that I always say is a disease that's under the radar. People have heard of diabetes, stroke, breast cancer, etc. But I cannot tell you how many times I have been in the emergency room with fairly sophisticated families who really never heard of aneurysms or don't know anything about aneurysms. So we wanted to give back. We wanted to raise money for research and raise awareness. So we decided to have a walk with speakers and a fundraising walk at Jones Beach. And this was a while ago, and 12, 13 years ago. And it grew and it grew and it grew. And we partnered with a terrific organization called the Brain Aneurysm Foundation, which is the biggest not-for-profit resource for aneurysm patients. And I would advise the listeners, if they're interested, to search BAF.org. It's a tremendous website and organization. And
Did you say B as in boy?
Yeah, Brain Aneurysm Foundation, BAF.org.
Okay.
And we partnered with them. We ran the walk every year, and it grew and it grew. And we have raised almost $1 million.
Wonderful.
And the monies are split between the Brain Aneurysm Foundation and our programs also at North Shore Hospital and Southside Hospital and Northwell Health. And what the monies are used for in the Brain Aneurysm Foundation are research grants for all different angles of research into brain aneurysms, where they are, how they are, what causes them to bleed, treatment modalities, etc. So I have worked with Christine Buckley, who's the head of the Brain Aneurysm Foundation, for years. And we invite all of our brain aneurysm patients and survivors and families to come to the walk, and it's usually in September on Field 5 at Jones Beach, and we walk on the boardwalk. And as a doctor, to be up on the stage and look out at 1,000 patients and families and loved ones that you have touched is a humbling experience for me and is just amazing. Now, whether we're going to go ahead this year or not, we have a date. We have to see what happens with COVID, with the governor, with social distancing, etc. That it's possible that we will alter the form of the walk or postpone it. We have to see. We will have to do what's safe. But the walk has been a terrific thing for our staff, for our nursing, for everyone who takes care of the aneurysm patients, and for the families. And it has been my honor to have, been part of the genesis of that walk and to run it every year. So if you add it up over the years, we've had, 15,000 attendees. We've raised almost $1 million for an excellent cause. So that's the story of the walk.
Yeah, congratulations with that. That's wonderful.
Thank you.
Phenomenal. And so with this pandemic, if it continues, I know you talked about other ways that you can bring awareness about.
Well,
probably.
Whether we're going to go ahead with the walk or whether we're going to have a smaller walk or a social distance walk,
right?
We need to do what's safe for our patients and our families. If we cannot have the walk, we are thinking about maybe a virtual event or something else to reach out to all the attendees, because people come to this every year. It's a very big event for some of the families. They bring teams and T-shirts, and it's an uplifting event.
So tell me, what is the characteristic traits of a neurosurgeon? Tell me what you have. I mean, think about that, right? How many neurosurgeons do you have on your team? It's you and
we have about 20 plus or maybe more.
Really?
30 in Northwell Health, maybe even more. On my particular team before I came here, when I was in North Shore, there were about 15, and here we have 3 neurosurgeons, myself and 2 other neurosurgeons, and a neurologist who does angiograms and does the coiling of the aneurysm. So we have 4 people on the team. As far as what traits a neurosurgeon must have, it's a very good question. It certainly attracts a specific type of individual.
And you don't have to be shy about talking about it.
I think it attracts a very driven individual. I think it attracts someone who believes in themselves a lot. There's no shortage of confident people, to put it mildly, in neurosurgery. It attracts people who are interested in science. I think it attracts people with manual dexterity. It attracts people who want to push themselves to the limit and to really be in a field that has no limits. It's an unbelievable field. There's sort of a profile of the type of individual that would be a neurosurgeon, but in the field, as in any field, there's all types of people. Yeah. And like I said, there's a variety of different types of neurosurgeons. There's private practice neurosurgeons, academic neurosurgeons, neurosurgeons who do research, pediatric neurosurgeons, aneurysm surgeons, trauma neurosurgeons. So it attracts different types of people, but on as a whole, I would say people who believe in themselves, people who were able to subject themselves to the training, to the 7 years of training, people with for the most part, a high degree of humanity.
Yeah.
It's a profession where you save lives over and over and over.
How do we contact you?
The easiest way for people to contact me would be to go on the internet and look up Southside Neurosurgery, and all of our contact information is right there.
Well, thank you for being with us, Dr. David Chalif, the Chief of Neurosurgery at Southside Hospital in Bay Shore here in Long Island, and the Director of Northwell Health Brain Aneurysm Center. We appreciate all the hard work you're doing and your team are doing, and congratulations again on your promotion.
Thanks for having me.
This is Dr. Jeanine Cook-Garard from the nursing department here at Nassau Community College, and I want to thank you for listening to this edition of Your Family's Health.
We'd like to get your feedback on your family's health. Send your comments by emailing them to whpc@ncc.edu. Podcasts of today's show are available on iTunes, Android Podcasts, and Spreaker. This program was produced at the studios of Nassau Community College in cooperation with the nursing department. Join us next week for another edition of Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.